Well, the inquiry examined four broad areas. Firstly, the effectiveness and efficiency of healthcare service delivery in New South Wales, the adequacy of data collection, monitoring and reporting of health information, provisions of timely and accurate information to patients and healthcare providers, and whether the performance frameworks drive improvements and achieve healthcare systems objectives. The committee called for public submissions. We received 34 formal submissions as well as 36 items of correspondence. Now, we responded to calls from the government for greater emphasis on mental health services. So we conducted a public forum and held meetings at Lismore Hospital and the mental health unit up there. And we held 3 public hearings right here in Sydney. Well, the inquiry's major findings are that the current performance information doesn't adequately take into account the general health of the community or gaps in service delivery. We found that there should be greater emphasis placed on the delivery of services to people with a disability and special needs groups. Improvements need to be made in data accuracy and governance and should be integrated across the health system. Of course, privacy standards should be given greater priority, but they also should be providing authorised access to patient records by designated guardians, their carers or family members. We found that proactive recruitment and training of nursing staff to specialise in mental health is needed. And finally, an increased use should be made of the genetic testing to determine drug treatment suitability. Well, the major recommendations that the committee offered were there needs to be a rigorous analysis of performance frameworks to improve health outcomes. There needs to be incorporation of service delivery information and data collection training for the rollout of the National Disability Insurance Scheme. There needs to be greater collaboration with the Commonwealth on integrating systems across the healthcare sector. We found development of privacy performance guidelines in consultation with the New South Wales Privacy Commissioner, finalisation of the upgrade to the Incident Information Management System, additional strategies to recruit and train mental health nursing staff, and dedicated funding for additional clinical pharmacologists and pharmacogenomic testing, which is a new area which the committee found to be of great interest. There needs to be improved management of patients by allowing MBS rebates for follow-up consultations. The committee hopes that there will be improvements in performance information and data collection to drive better patient and health system outcomes, and a close examination of current and alternative drug treatments for mental health patients. I hope the report will assist the Ministers' Advisory Council develop improvements to the collection of performance data, and importantly, its coordination and integration across all sectors of our healthcare system.